I'm going to go in a couple of different directions when it comes to the commentary that I'm going to bring to you right now. And I can honestly say I am not shocked that mainstream media is going the direction that it is going in when it comes to discussing the Wuhan and black people. Many of us knew it was probably coming. And many of you who are subscribed to me over the last couple of weeks of me doing these videos have said I will not be surprised if they try to make black people the face of this disease, illness, virus, whatever you prefer to call it. And that is starting to prove to be true with three different things I've heard so far this week. The first one I've heard about, and you may have seen it already, is those French doctors who went over to Africa trying to push some type of vaccine. Now, if you don't know the history of the French in Africa, you will know that, or you may have not known that, the French is heavily in debt to Africa. Africa has been keeping the French afloat for many years. I think one of their political figures over there even openly admitted that a couple years ago, from what I've heard, that if it wasn't for the African economy as a whole, they would not be able to thrive. And Lisa Cabrera recently did a live stream where she was talking about those two French scientists or whoever they were. And y'all may have seen the videos in which I'm talking about, where they so-called apologize for saying that they were going to do some kind of vaccine over there. And you notice every time something like this happens, and whenever something occurs and it happens in around the world or in certain places, that one of the places they always like to talk about where it hasn't hit is Africa. They love to say, why are there so little cases here in Africa? They always ask that question. Always. You always have to pay attention to how mainstream media says certain things, or when it comes to especially the black people. But they always do, and I always catch it every single time. Now, then you have an article that I also came across where they said in Detroit, the black population up there has the highest number of cases for this virus. Then I got another article that I'm going to read, where they said Chicago. Now, they had to find a way to bring Chicago up because, they can't talk about black on black crime and all these shootings that have happened over the last couple of weekends when it comes to Chicago, because they love to say, oh, this shooting happened and there's so many people died and all this, that, and the third. So now what do they replace it with? In Chicago, 70% of the virus deaths are black. This, ladies and gentlemen, is how you make a group of people the face of a virus that, one, they did not start, and two, most likely they prop these numbers up. Remember, they did the same thing with HIV and AIDS and a host of other things because they need black people to be the face of everything bad. Now, notice when they were putting these numbers out before on like CNN and MSNBC and all those other networks, they would talk about Americans as a collective. They didn't single out a particular group. They didn't single out palm colored people. They didn't single out Asians. They didn't single out Hispanics. They didn't even single out black people. But when they could get enough numbers for black people where they are high enough to their liking, they will put it out there. So far, like I told you, they did it with Detroit, and now they're doing it with Chicago. And Detroit and Chicago I don't know what the distance is between the two cities, but state-wise, they're in that same region. And Detroit, as you know, has a pretty decent black population, and of course, Chicago. So I would not be surprised if they're going to do this again with other majority black populated cities. And that is how you make a group of people the face of something. You put it out there enough. Then you had Adam Housley with his bitch ass talking about they need to send all these back. Y'all saw the video. about them having to send all these bags and over there to South Africa because of the AIDS and everything like that, which is another propaganda piece that he just came up with out of his ass because he's bored and because he's a racist. But I'm going to go ahead now and I'm going to read this article. The virus is killing black residents in Cook County at a disproportionately high rate, according to early data analyzed by WBEZ. While black residents only make up 23% of the population in the county, they account for 58% of the virus deaths. Now look at that. Black people there only make up 23%. That's fairly low, but they make up the highest for the people that contracted the virus. What does that sound like? 13% of the population, but commit 50% of the crime. Already, I don't believe what I'm hearing. Because they love to do disproportionate things with stats when it comes to black people all the time, to make it seem like our situation is worse than what it is. Now, let's just say that 70% that they put out there is actually factual. You got to question why that is. Hopefully, this article goes into that. And if not, I'm going to give my take on why I believe that is. As of Saturday, 107 Cook County, 183 deaths from the virus were black. In Chicago, 61 of the 86 recorded deaths, or 70%, were black residents. Blacks make up 29% of Chicago's population. The majority, and see there again, a very low population of black people, but they have these high numbers. Why is that? The majority of the black virus patients who had underlying health conditions, including respiratory problems and diabetes. 81% of them had hypertension or high blood pressure, diabetes, or both. As the virus continues to spread, the high mortality rate for black residents is alarming. It's disturbing and upsetting, but not surprising, said Linda Ray Murray, health policy professor at the University of Illinois. This is just a reflection of the facts that we already know about these pandemics. People are vulnerable, will die quicker, and won't have as many resources. It's still early in the pandemic, and health officials are assessing information on which groups of people are being affected. Dr. Ngozi Ezike, director of the Illinois Department of Public Health, said Saturday. Ezike said she would not be entirely surprised if a disproportionate number of deaths were occurring in black communities. As we put on our healthy equity lens, we already know that before the virus was ever established, that the health outcomes for various communities are already different. So if you already know those disparities exist in terms of health outcomes, you can imagine that overlaying a new disease is going to exacerbate whatever inequities already exist. Historically, Chicago's black communities have been disproportionately affected by health-related issues, including poverty, environmental pollution, segregation, and limited access to medical care. Historically, Chicago's black communities have been disproportionately affected by health-related issues. Oh, I'm sorry, I read that part already. These conditions contribute to high rates of hypertension and diabetes. In Illinois, the rate of high blood pressure for black residents is around 48%. Some of these historical factors are raising the risk for black residents in the virus outbreak, said Murray, a former political official in the Chicago Department of Health and previous chief medical officer for Cook County Public Health. That was the case for 61-year-old Patricia Friesen, a black woman who was the first person to die in Illinois from the virus. Friesen, a retired nurse, died on March 16th, and a week later her sister Wanda Bailey, age 63, died. They both had hypertension or diabetes. It can be more difficult for black residents to practice social distancing because the population is more likely to use public transit and hold jobs that can't be done from home. In poorer communities in the city, persons of color, and I hate that term, are also more likely to live in crowded homes. You just have a lot of people living in a house, said Antonio Davis Jimenez, director of the University of Illinois at Chicago's Community Outreach Intervention Projects. Jimenez said that many people that we serve in the neighborhoods that we target, they can have multiple people living in a household, and so it's really difficult to stay inside and do this thing. In fact, there's an incentive to want to go outside. Murray is particularly worried about the black population that's incarcerated during this pandemic. The number of black residents with the virus statewide is also disproportionately high. Blacks account for 38% of confirmed cases in Illinois, but they are only 14% of the population. The state has not released a racial breakdown for deaths, although Illinois is one of the few states that keeps the virus data with a racial breakdown. That's crazy. They said that right there. They haven't broken down racial wise what these deaths are, but they couldn't wait to throw out the black people who have died from this in Chicago and in Detroit and possibly anywhere else going forward. Like I said, this is how you make black people the face of a pandemic. According to ProPublica, the Centers for Disease Control and Prevention typically tracks detailed data, including race during outbreaks, but the federal agency did not respond to ProPublica's request for data that includes a racial breakdown. There's been a push to get a racial breakdown of the cases at the national level, said Murray. It is important to get the data so that resources and culturally competent information can be distributed. And I think that ProPublica site is where I saw that part about Detroit, if I'm not mistaken. But yeah, they know exactly what they're doing. Like I said, they haven't. Now, it's not only black people that live in Chicago, it's other people that live there too, but they couldn't wait to put out the data about black people as if they are the only ones there. But like I said, because in Chicago, they cannot talk about these shootings, quote unquote, that happen every other weekend. Sometimes, and if it let mainstream media get a hold of it every weekend, they have to put this out. They have to have something bad about black people coming out of Chicago, because for the last few months, you haven't heard anything about that, those shootings that have occurred, or they don't get as much traction anymore if they still do put those kinds of stories out there. Or should I say those kinds of lies? So what do? You take something that's trending like this virus and you racialize it and you throw it into Chicago because of the stipulations that come from there or the stigma. And then boom, now you have something to talk about with black people in a not so good way. Y'all let me know what y'all think about this down in the comments. Like, share, subscribe. Make sure you follow me on Twitter if you haven't done so already. Have your notifications turned on, and I will talk to you in the next one.